I'm Harley and I will be your host today. Today's guest I will be introducing is Jonathan Karro.
Thank you very much, Harley, and thank you to you and all your teammates for inviting me to speak. I'm very grateful to be given this opportunity to speak to you guys, and I hope I can impart some knowledge and let you guys know a little bit of what it's like, as Harley says, on the front line. I have heard it said, I think it was maybe our premier, that everyone in the public, that you guys are the front line, and if everyone in the community does the right thing, we're actually last line of defense. I remember I was doing a shift at another hospital called Clancy Hospital. It was in about January, and things had only just started in Hubei province in China, where we started. They were having lots of coughing and fevers, and no one had ever seen an illness like this before. And was people actually coming from China. We were very worried that they would bring this particular virus with them. To leave our homes as adults, we need to wear a mask. So things have changed really rapidly. It's only been 6 or 7 or 8 months, and now the world's in what we call a pandemic.
Good afternoon. I'm Harley and I will be your host today. Today's guest I will be introducing is Jonathan Karro. Wow, we have the same last name. That's because he's my uncle. Jonathan, also known as Jonty, Deputy Director at St. Vincent's Hospital. He was born in Johannesburg, South Africa, and moved to Australia in 1990 when he was 14 with his family. As the Deputy Director of St. Vincent's Emergency Department, he's in the front line of this pandemic. So now over to you, Jonathan, for anything you'd like to share.
Thank you very much, Harley, and thank you to you and all your teammates for inviting me to speak. I'm very grateful to be given this opportunity to speak to you guys, and I hope I can impart some knowledge and let you guys know a little bit of what it's like, as Harley says, on the front line. I have heard it said, I think it was maybe our premier, that everyone in the public, that you guys are the front line, and if everyone in the community does the right thing, we're actually last line of defense. It's only when you get sick that you need to come see me. So hopefully, if everyone in the community does the right thing, then no one has to come see me. But obviously that's not the case at the moment. It's been a really interesting journey. It sort of first started, I remember I was doing a shift at another hospital called Clancy Hospital. It was in about January, and things had only just started in Hubei province in China, where we started hearing about a novel virus. What I mean by novel, a virus that had never been found before. In fact, it was an eye specialist doctor. He got COVID from a patient, and then started noticing that lots of patients were having very similar symptoms. They were having lots of coughing and fevers, and no one had ever seen an illness like this before. And so the first warnings we got was people actually coming from China. We were very worried that they would bring this particular virus with them. So I remember I was doing this shift, and we had a family come, a mum and a dad and a few kids, and they had been in Hubei province, and they had a cough. And so it was the first time that we had to think about, how are we going to keep them safe? How are we going to keep ourselves safe? And something that was very funny was that I put a mask on myself. I was going on leave soon after that, so I put a mask on, and everyone said to me, "Don't be silly. What are you doing? You don't need a mask." And look where we are today. We're really, to leave our homes as adults, we need to wear a mask. So things have changed really rapidly. It's only been 6 or 7 or 8 months, and now the world's in what we call a pandemic. A pandemic is when there is spread amongst people in the community in multiple different countries of a new illness. In fact, this is the first of its kind since in 1918 or 1917, when there was an illness called the Spanish flu, that a lot of people around the world got really sick when they were returning home from World War I. It spread all around the world, and we're experiencing that now with coronavirus. So I then obviously, as Harley said, I'm the Deputy Director of Emergency Medicine at St Vincent. So I was on leave from Casey Hospital and I came back to St Vincent's and we started meeting all the different heads from the hospital. We would meet regularly to try to plan what were we going to do, because what happened is we started seeing in Italy first. In Italy, there was a huge outbreak of coronavirus and so many people in Italy got the infection. So many of them had to go to hospital. The hospitals were overwhelmed. There weren't enough hospital for all the different patients to get all the care they needed. And we started wondering, is that going to happen to us in Australia? And so we started planning what could we do? What was all the equipment we were going to need? How many doctors and nurses and physiotherapists and hospital beds were we going to need to look after all these patients? And one of the main things we thought, just like Italy, we thought all these people were going to be really, really sick. And we were going to need to help them breathe. You know, there's things we can do where we put a tube into someone's throat so that we can breathe for them if they can't breathe enough. And we can also, do lots of things to try to keep people alive if they're very, very sick. And we thought that was going to happen to us. And the government in Australia and in Victoria, they just did an amazing of not letting high-risk people come into the country. And if high-risk people for having coronavirus did come, we kept them safe and we kept the community safe by advising people not to go out very much and stay home and a few other things. And it looked like we had actually got rid of coronavirus. The levels were getting really low of people with it. And what we would call the first wave of infection seemed to be settling down and everything seemed to be really, really good. So in fact, all the hospitals, we started thinking, we can start looking after our regular patients again. But then very soon after that, there was an explosion in cases again, and the numbers in Melbourne started going very high again, and we started getting really worried at the hospital. And this time we started seeing actually a lot of patients with coronavirus, and we see even more patients with what we call suspected coronavirus. When someone arrives in hospital with a fever or a cough or muscle aches or all the things that could be coronavirus, we don't know at that time if they've got coronavirus or not. So we have to treat them pretty much like they do until we can work it out. And the way we prove whether someone has coronavirus or not is we put a swab. First of all, in their mouth. So it's like a really long cotton bud, a cotton tip bud, and you put it in their throat and swish it around. And actually, I don't know if you have any has anyone had a coronavirus test here? You could just nod, or I don't suspect so. I've had about 7 so far and they've all been negative, which is good. So we put it in the person's throat and then we put it really deep into their nose. It goes in like that far to the back of your nose to see if there's any virus in the back of your nose. And we have to wait sometimes for a day or two for that test to come back. If we're really worried about something or for some other reason, it's a really serious situation, we can sometimes do what's called a rapid swab where we can get the result within an hour or two. So in the last few weeks, we've started seeing, as I say, lots of people with coronavirus. The emergency department, when I left there today, there was about 15 people in the emergency department who either had coronavirus or were suspected of having coronavirus, and they needed to be admitted into hospital. The good thing that we're realizing at the moment is that in Australia, it seems like most people aren't getting really sick from coronavirus. They're getting a flu and they feel really yucky for a few days and they've got the cough and the fever, but there have not been very many cases where someone is looking like they might get really sick and need us to breathe for them, or some people have died, and most of those people have been really old people. There hasn't been really many young people, and we're very thankful for that, and we hope that continues. But one of the most important things for me, and one of the things I've seen as my primary role, the thing that's the most important for me, is to make sure that my staff are safe, because I don't want them getting coronavirus. So it's so catchy, this virus. All you need is someone to have coughed and sneezed on their hand, and they touch a wall or a door or a cup, and that can even stay there for several hours. And if someone just touches that and then they touch their face, you can get coronavirus. It's very, very transmissible between people. What I mean is it's very easy to catch it from someone. So one of the most important things for you guys is to know how you catch it from someone, so that you can look after yourselves and your families, and so that you know. So one of the things, it's a little bit unclear, but we don't think that coronavirus is spread by something called aerosols. And aerosols would mean that the virus would just be in the air, and you could just be walking out on the street or sitting in a room with someone, and it's in the air and you can catch it. Whereas measles, I don't know if you guys have probably heard of measles. No one gets measles these days because we're all immunized, hopefully. But when I was growing up, people got measles, and measles is even more catchy than coronavirus. And you can just go in a room after someone with measles has left the room, and you can just catch it out of the air. But we don't think that that happens with coronavirus. So the way you catch it is it's in people's mouths or noses. So if they cough on something or sneeze on something, including, if you cough into your hand and then you touch something, and then if someone else touches that surface and then touches their face, that's how you get it. So that's why we're all wearing masks. So if you cough or sneeze, it doesn't go on anything, and it doesn't go on your hand, and it doesn't go on a doorknob or a cough or a wall or any other surface that someone's going to touch. If someone sneezes and you're very close to them, it is spread by what's called droplet spread. When you cough or sneeze, droplets come out of your mouth. I don't know if you've ever seen, when you sneeze, sometimes some stuff comes out. Those are called droplets, and they only travel about a meter or two. So if you keep 2 meters away from someone, even if they cough or sneeze, the droplets fall to the ground and you don't tend to catch it. So that's why the government and all our health leaders are telling us you keep 1.5 meters or 2 meters away from people, you physically distance. We called that, initially we called it social distancing, but what we're realizing is humans are very social beings, and we need connection with each other to be happy and to live happy lives. So you don't need to socially distance. We can catch up in a forum like this. I can see all of you. You can see me. We can speak. But you do need to physically distance, not get too close to people that you don't know. And then we wear a mask so that, as I say, if you cough or sneeze, it doesn't spread the virus onto other surfaces. So I showed you one picture. So when I go to work these days, I have to wear what's called PPE, personal protective equipment. So I have to have something that's covering my mouth and nose. So that's a mask. It's a different mask to what you guys wear. It's called an N95 mask. So virus cannot get through that mask. So it fits really tight on my face. It's actually very uncomfortable. And to wear that, for a 10-hour shift, with one break, it's not easy. And you can see I'm wearing what's called a face shield, which is a plastic shield across in front of my mask, so that if someone coughs or sneezes or something like that, it goes onto the face shield and not onto my face. You can see my stethoscope around my neck there, and at that time I was working in what's called the fast track area, so it's a very low risk area for getting coronavirus. But we also wear these gowns as well now, and the gowns make you feel very hot. You're so lucky that we live in a country like Australia, where I can be provided with as much of that equipment as I need to keep me and the rest of my staff safe. If you live in some other countries, or even if you were in Italy or New York early on, they didn't have time to prepare like we've had, and doctors and nurses were wearing garbage bags and things, and many of them got coronavirus. In fact, as a healthcare worker, I am at increased risk of getting coronavirus. about 20%. So 1 in 5 people around the world that get coronavirus is a healthcare worker. So we are at risk. And in fact, even in my emergency department, we have had 25 staff members with coronavirus. We're very lucky. None of them have got particularly sick, but some of them, as I say, have felt pretty unwell, but none of them have needed to be admitted into hospital, and none of them have got really sick. So we're very lucky. And we worked out what we think was causing the infections. And in fact, we weren't getting it from patients. We were getting it from each other when we would be too close in the tea room, or we would all sit around having our lunch and dinner when we didn't think each other was infectious. Now we're very careful. We've built extra places for people to go have their lunch and dinner so that they can keep 2 meters away from everyone else. And we're very careful with cleaning. In fact, I've probably forgotten one of the most important things about stopping ourselves from getting coronavirus, and that is washing our hands. Because if you touch the surface or if you cough into your hand, the virus is on your hands. And it's much more important than even wearing the masks and all that other stuff, is everyone being very careful to wash their hands, especially before you touch your face or eat or do something that might give you coronavirus. So I've been speaking for 17 minutes now. I could go on a bit, or should we stop for some questions?
Thank you for that, Jonathan. Does anybody have any questions?
You don't need to be shy. You can ask it, and there's no silly question. I can see Olivia's got a question.
Would you like to ask?
Yes, hi, Jonathan. When you're at work, do you feel nervous being in the hospital because there could be patients around you who have coronavirus, even though you have all the protective equipment?
That is a fantastic question. It's such a great question. And I've gone through different phases. I remember when it was first happening, I had this thing that I needed to lead the rest of the staff, and I was ready to take it on and just do whatever was necessary. I have days now where I do get nervous. So when I see someone who I know has coronavirus, it does provoke fear in you, and I need to look after that person. So what I basically do is I just be really careful, and what I tell all the staff is we slow down. So commonly working in the emergency department, I'm sure you guys imagine, sometimes we need to act really quickly to do things. Things might happen to a patient and we need to rush and do it. When you're going through a pandemic, it's different. There's a saying, there's no emergency in a pandemic. And what that means is, no matter what's going on, you take the time to protect yourself. If I wasn't wearing my PPE and something happened to a patient, I've got to protect myself first, get my PPE on, and then go see the patient. So yes, I am nervous. I have some good days and some bad days. And I've also noticed I have to look after all the other staff, and some of them on some days are having a really bad day, and on some days they're having a good day. So I think the most important thing is to realize that so many different emotions can be normal, and fear can be one. It's okay to feel how you're feeling, and I think it changes from day to day. But that's a fantastic question. While Tacey's doing that, I'll show you another picture. Is a different kind of N95 mask, and the goggles that I need to wear as well. So that also stops things from going into my eyes. And that particular mask is the one we wear more commonly, and it's very uncomfortable, and lots of staff are complaining about it. But as I say, we're very lucky to have this equipment.
Casey's question, how often do you need to get tested?
So that's another fantastic question. At the moment, we're getting tested every week because we've had staff that have had infections. So we go undergoing what's called asymptomatic staff screening, which means that most of our staff at work, we feel fine, but every week we get a swab, and it's very unlucky. We just completed it. Over the last 3 days, we tested all our staff, and we found one more staff member. She felt absolutely fine, but she tested positive for coronavirus. Each time we do it, we tend to pick up 1 or 2 cases. So it depends. So I get tested at the moment every week, but then there's other hospitals where they don't have many infections and they wouldn't need to get tested unless they got symptoms, unless they felt unwell. We're going to keep doing it every week until no one else gets it.
Or Amelia?
Does your hospital have any of the worst cases in Victoria?
So another great question. So at the moment at our hospital, we've got 4 patients who needing what's called intensive care. And in intensive care, that's where you need to monitor everything that's going on with the person, and you commonly have to breathe for them. You have to even feed them through tubes. You have to give all their fluids through tubes. They're usually unconscious, so they're not uncomfortable, but they've got lots of tubes and lines, and we need to support all their organs. So there's 4 of those people at the moment, and yeah, so there's 4 of those.
Does it hurt when you get tested?
It doesn't hurt, but it is uncomfortable. As I said, the cotton bud, which is bigger than a normal cotton bud, it goes very deep and it is uncomfortable. And if you don't do it properly, the test's going to be negative, even though you might have coronavirus. So the nurse, when she sticks it into my nose, she has to count to 5, 1, 2, 3, 4, 5, while it's in there so that she can get the swab. So it doesn't hurt, but it's uncomfortable. It does bring a tear to your eye, and you commonly need to sort of have a sneeze afterwards, but it doesn't really hurt.
One more from, was it Olivia? Did you have one?
Can I just ask, what do you mean by breathing for your patient?
So it's a great question, and I'm trying to work out, the best to explain it. So when patients get really sick, sometimes they can't breathe for themselves. That's the main thing that happens with coronavirus. So if you get coronavirus, you know how we breathe in oxygen, yeah? And when you get coronavirus, your lungs get damaged, and it's hard to get enough oxygen. And so you get very tired breathing as much as you need to breathe. And then so sometimes you might get tired and then you don't breathe enough. So if you can't breathe enough, what we do is we put you to sleep so you're really comfortable. A plastic tube, I don't know if you've ever seen it in the movies, and we put the plastic tube into your throat so that we can blow your lungs up with a machine. And it doesn't hurt because you're asleep and you're comfortable, but we can give you the oxygen while your body recovers.
So I think that was all the questions, sir. I think we'll finish up now, unless, Jonathan, there's anything you'd like to say before we finish up?
Well, I'd just like to say that it's been absolutely fantastic. I'm honoured to speak to you guys tonight. I hope you all keep safe and you can go home and tell your families about hand washing and wearing masks and physical distancing. And I just hope you guys all keep safe, you and your families. And then the thing we're really hoping for is a safe vaccine soon, so we can all have a vaccine and return to our normal lives.
Thank you so much, Jonathan, for speaking to us today, as well as being a great help during COVID-19. We will really appreciate it. It's been great to learn about your past and maybe to influence us in the future. So overall, thank you very much on behalf of Glen FC Girls Home Football School.
Thanks heaps, guys, and I wish you all the best for your soccer when you can get back to it.